And we are back here on Talk of the Town. I'm Betsy McDaniel in for Robin Zimmerman today, and we are going to be talking about Medicare open enrollment with Dieesha Hicks, and she is here as the State Health Insurance Assistance Program Manager. That's a little bit of a mouthful, so I wanted to make sure I got that right. Thank you for being here today, Dieesha. We appreciate it.
No problem. Nice to be here.
Yeah. So let's talk a little bit about Medicare enrollment. What's happening? What do we need to know? Tell us all the details.
So Medicare open enrollment is a chance for Medicare beneficiaries every year to look into their plans to make sure that all of their benefits are covered for the following year. Medicare open enrollment starts October 15th through December 7th, and your new plan will start in January. So January the 1st of the following year.
Okay. And what are some of the things that people should really be looking at in their plans that they might not even be aware that they should be making sure of?
Definitely their prescription drugs, because each year the formularies change and so do the tiers. So you may have a drug that's kind of low cost this year and your plan premium may be low cost, but they change every single year. Okay. You're not obligated to change plans, but it's definitely good for everyone to check to make sure that their drugs are still covered for the following year.
And let's say, for example, maybe it isn't covered as much as it was and the price does go up. Is there any way to mitigate that?
So, because especially if you just have a drug plan, so you can get your prescriptions with any plan as long as they cover your drugs. Okay. So there's plenty of drug plans in our area that you can choose from and you can switch to each year because they will change. Right.
And talk to us a little bit about the assistance that you give and who specifically qualifies for your assistance and how they can get to you.
So I am pretty much, and it was a long name that she gave you earlier, but basically I am the Medicare advocate. So I do all things Medicare. I teach classes. I offer unbiased help. We don't work for any specific company. Yeah. So we're really here just to help the people. So if someone wants to review their plan, they could call me and we could go through it step by step and I could help them change or just help them realize that the plan they have now is the best plan for them.
And so you are an advocate for all of South Carolina?
For Hampton County, Beaufort County, Jasper County, and Colleton County.
Okay, so right around here in the LowCountry, perfect.
Yes.
And again, so obviously the prescription drug is probably the biggest thing that you want to make sure that you're looking at. What are some of the other things? And if somebody's actually maybe just enrolling for the first time, what do they really want to be looking for to make sure that they have in their plan that they're aware that what's there?
If they are just enrolling for the first time during that time, what I usually do is try to get them in what's best for the rest of 2024, and then maybe the week later we review what would be best for 2025. Okay. So that's usually what helps. And if they have a Medicare Advantage plan, just making sure that their doctors are still in the network, that their premiums haven't increased, and some of the additional benefits like dental, vision, and hearing, you want to make sure that that max is still the same as it was for the year you enrolled into it.
Okay. And talk to me a little bit about somebody who does qualify for Medicare, because if there's somebody out there that they're not sure, what do they need to do to qualify?
So there's 3 different ways you can qualify for Medicare. The most common one is aging into it at 65. Right. And so you age in at 65, you're in your initial enrollment period. So you have 3 months prior to your birthday, the month of your birthday, and 3 months after to enroll in your initial enrollment period without penalty. Okay. And then you have those who are on Social Security disability. They are automatically enrolled after 24 months. Okay. And then those who have end-stage renal disorder, they automatically qualify for Medicare.
Okay. So the two where you're having some sort of a disability, they automatically qualify and are also automatically enrolled. But if you hit the 65, you have to make sure you're doing it on your own.
Right. Okay. Unless you're already receiving your Social Security retirement benefits.
Okay. Well,
but if not, you have to contact Social Security to start the initial enrollment process.
Gotcha. Well, thank you for being an advocate. I think that's fantastic that you're there as a resource for people, because obviously it's something that is a little bit confusing to navigate. So thank you for being that resource for us.
Thank you. And if you guys would like to know, you can follow our LowCountry Council of Government page on Facebook. I'll be doing several welcome to Medicare 65th birthday parties or lunch and learns, however you want to put it, but they're free. It's a lot of information, and I'm here to answer any questions you may have.
I love that. So follow them on social media. Absolutely. Thanks, Dieesha.
You're welcome. Nice to meet you as well.
Nice to meet you.